Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the area that you had requested. The area of interest is the lower right 7 and the lower right 8. This is the panoramic view. On the panoramic view, we can see there is a distal cavity in the lower right second molar, and there is a mesioangular wisdom tooth present as well. Taking you to the transaxial view. The transaxial view will show us in the proximal section. So this is the transaxial view. We can see that the mesial side there has two roots. Has the tooth has two roots on the mesial surface. There is one root, and there are two canals present. The two canals join to form one at the apex. There is no separate exit for both the canals. The estimated working length of this tooth is in the mesial surface is 21 millimeters. Moving to the distal aspect, this is where the cavity is. The cavity is in very close proximation to the nerve at the distal aspect. And if we move to the distal root aspect, we will be able to see that the distal root is quite significantly close. Now, the cavity part is invading into the nerve space on the distal aspect, which can be seen. The distal root is single, and the canal it contains is single as well. The estimated working length is also 20 millimeters in the distal root. There does not seem to be a significant periapical pathology at the moment. We do see a little bit of a hypodense area at the apex, which is also connecting to the lingual cortical plate. This could also result in an infection which is draining into the lingual spaces of the patient if the patient has any swellings. Moving to the distal aspect, where here we can see this is where the interdental area between 7 and the 8 is present. We see a radiolucency here. Moving to the wisdom tooth, the wisdom tooth has a cavity on top. This is the pulp chamber area. If we move the tooth slightly distally, we can see that the crown portion is significantly out. This is the cavity in the wisdom tooth as well. As we are moving towards the root of the distal tooth, we can see that the root area is significantly far away from the inferior alveolar nerve canal. So this is the apex, and this is 3 millimeters away from the inferior alveolar nerve canal. As we are moving distally, the apex, the tooth is going to move along the ramus superficially, but it is not in contact with the nerves at any point, and we've got a significant distance between the wisdom tooth apex and the inferior alveolar canal. If we move to the axial view, this is the axial view. Here we can see that there is a radiolucency on the distal aspect of the 7. I'm going to zoom in for our doctor where they can see that this is the 7, which has two canals in the mesial root, single canal in the distal root, and we can see that there's a radiolucency present here as well. This is the wisdom tooth. The wisdom tooth is mesioangular. It is significantly far away from the inferior alveolar nerve. We see a very thick buccal cortical plate and a relatively thin lingual cortical plate because the tooth is positioned very lingually. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.